When doing the examination, there needs to be good lighting. The patient needs to lie on a flat bed at 180 degrees with a single pillow. Their hands need to be extended by their sides. Their body needs to be exposed from the waist up. The examiner's hands need to be warm. The patient's bladder needs to be empty, as well as the patient needs to be relaxed and comfortable. We must inquire about any discomfort or pain that the patient might be feeling. When examining, you must constantly check the patient's face in order to check if they're experiencing any pain or discomfort which they haven't told you about.
As the patient walks in, I am observing 4 signs of pain on their face, visible skin hanging loose from the abdomen and limbs indicating muscle wasting, obesity, whether their gait is abnormal, and whether the patient is guarding their body in any way. None of these are present.
Hello, my name is Amirah Gabru.
Hello, my name is Refilwe Madumo.
Hello, my name is Emerei Butoi.
Hello, I'm Suné Minnaar.
Hello, I'm Simoné Du Preez.
Hi, I'm Shakeel Amlay.
Hello, I'm Zayyaan Khan.
Hello, I'm Smuts.
Hi, I'm Bonisile Ndebele.
Hello, I'm Hlawulekani Hlongwane.
Hello, I'm Rayghaan Rawoot, and we are all first-year medical students.
We will begin with a general examination using the acronym JACL as a guideline. We will then proceed to the gastrointestinal examination consisting of inspection, palpation, percussion, and auscultation. Can we please have your consent to continue with these examinations?
Yes, that is fine.
Great. We will begin with J in JACL, which stands for jaundice. Jaundice is a yellow discoloration due to hyperbilirubinemia, a common sign of liver disease. I will be examining the sclera of the eyes. May I please examine the eyes?
Yes, ma'am.
Okay. Look up for me, to the left, and to the right. Great. The sclera of the eyes are white and normal without any discoloration. While at the eyes, I will be examining for xanthelasma, which is yellow plaques in the periorbital region indicating lipid deposits and further cholesterol. Will you please close your eyes for me? There are no deposits around the eyes. I will now examine the buccal mucosa, which is the lining of the cheek and the back of the lips, for any discoloration. Will you please open your mouth for me? Great. The buccal mucosa is pink and normal without any discoloration. I will now move to the lightest part of the body, the inside of the elbow, both sides. Okay, there's no discoloration and it looks normal. Here I'm also examining for any red marks or scratch marks indicating pruritus or itchy skin, which is also indicative of jaundice. Moving to the palms of the hands, which are normal without any yellow discoloration. Here I'm also looking for red palms indicating palmar erythema, which is a sign of chronic liver disease. I'm also palpating for Dupuytren's contracture, which is a thickening and contraction of the palmar fascia, which results in permanent flexure, commonly involving the ring finger. It's not present here. Flipping the palms over and looking at the nails, I'm examining for leukonychia, which is white discolored nails, which is present in chronic liver disease. I'm also looking for red nails, as seen in polycythemia and caused by splenomegaly. Continuing with the examination for jaundice, I could examine the patient's feet. The soles of his feet would be yellow tinged if jaundice was present. I'm now going to ask the patient about the color of his urine and stool. Sir, has the color of your urine and stool been normal or abnormal recently?
Normal.
Okay, that's great. If jaundice was present, the urine would be very yellow or brown in color and the stool would be pale. If jaundice is present, always inquire about the onset.
I will be doing A for anemia. Anemia is a deficiency of iron or iron hemoglobin. First we examine the skin, then we go from head to toe to check for anemia. If the patient presents as tired and pallor, this is a sign of tissue hypoxia, causing pale skin and pale mucous membranes. This, however, is not a reliable indicator of anemia, as different patients have different degrees of skin pigmentation and different amounts of fluid present in the subcutaneous tissue. Thus, in darker skin tones, we cannot check for anemia in the skin. Then we look at the eyes. In the eyes, we look at the sclera. Please look left and right. And then we look at the palpebral conjunctiva. Please look up. If these areas present as pale, then the patient presents signs of anemia. Then we look at the buccal, then we go to the mouth. We first look at the buccal mucosa. If it is yellow and soft, then the patient shows signs of anemia. Please open your mouth. Then we go to the hands. Please show your fingertips, like this. If the fingertips present as pale, this is also a sign of anemia, as there is no red hue from iron supply. Then we look at the nails, please do this. If there is any sign of cholinicia, the nails would have a spoon shape on all 10 fingers. Then we look at the palms. Please close your hands and open them. If the palmar crease is still pale, then the patient shows signs of anemia. The patient does not show any of these signs, thus he does not indicate any anemia.
I will be doing the first C in Jackal for clubbing. Clubbing is an increase of the soft tissue of the distal parts of the fingertips and toes. We test for clubbing as it is indicative of various gastrointestinal diseases, such as inflammatory bowel disease, celiac disease, and chronic liver disease. We test for clubbing by doing two tests. First, the rocking the nail bed test, and second, shamrock test. First, I will be doing the rocking the nail bed test. So if you could extend your hands. If clubbing is present, the nail bed will be able to rock from side to side. May I examine you?
Yes.
The nail bed is not able to rock from side to side, and thus there is no clubbing present. The second test I will be doing is the shamrock test, where if you put two fingers of opposing hands next to each other, there should be a window or an opening. If there is no window or opening, then clubbing is present. Sir, if you could please do as I have demonstrated. There is a clear window and a clear opening, thus there is no clubbing present. In order for clubbing to be called a condition, it must be present in all 10 fingers or toes. This patient does not have clubbing.
I'm doing the second C of Jackal, cyanosis. Cyanosis is the blue discoloration of the skin and the mucosa due to deoxygenated hemoglobin. There are two types of cyanosis, central and peripheral. For peripheral cyanosis, I will observe for blue discoloration of the tip of the nose, the fingers, and the toes. There's no blue discoloration, hence no peripheral cyanosis. For central cyanosis, I will look at the lips and the tongue for blue discoloration. Please stick out your tongue, lift it up, move from side to side. There's no blue discoloration, hence no central cyanosis.
Edema is excessive fluid retention in the tissues of the body and most commonly occurs within the legs, feet, and ankles. It is frequently caused by liver cirrhosis, kidney damage, as well as long-term protein deficiency, although other causes do exist. The most prominent signs for edema, for which we will be checking soon, is stretched and shiny skin as well as swelling of the affected body parts. The edema we will be testing for today is peripheral edema, which is edema within the tissues perfused by the peripheral vascular system, and usually occurs in the lower limbs. Sir, could you please lie down? Do I have your permission to touch you, sir?
Yes, that's fine.
To test for peripheral edema, you can apply pressure to the leg, to the distal part of the tibia, or the dorsum of the foot for a few seconds, and then release. If the inlet you created takes longer to refill than you applied pressure, then this can indicate edema. Although edema can only be present if it occurs in both the left and right sides of the body. In this case, the patient indicates edema on either the left or the right, and therefore edema is not present in this patient.
I will now examine the lymphadenopathy of the patient, paying special attention to the size, the shape, the motility, tendency, and consistency of the lymph nodes. An enlargement of the lymph nodes would suggest some form of systemic infection, which would then need to be treated. Do I have your permission to examine your nodes?
That's fine.
So the main lymph nodes that will be examined are the preauricular, the postauricular, the occipital, the tonsillar, submandibular, submantle, can you turn your head to the right for me please, the anterior cervical chain, posterior cervical chain, deep cervical chain, and lastly, the supraclavicular. This concludes the general examination.
Next, we will be starting with the inspection. So can you please lie down for us and take off your shirt, please? First, I will be dividing the abdomen into 4 quadrants. Okay, may I please touch you and examine you?
Yes, you may.
Okay, so the 4 quadrants is divided by 2 lines. First, the mid-sternal line will divide the abdomen into a right and a left side. Then the mid-sternal line crosses inferiorly through the umbilicus, and then a horizontal line also crosses the umbilicus. This gives us 4 regions: the right upper quadrant, which contains the liver, the left upper quadrant, which contains the stomach and the spleen, the left lower quadrant, which contains the descending colon and the sigmoid colon, and then the right lower quadrant, which contains McBurney's point. McBurney's point is the surgical site of the appendix. Now I will show you how to find McBurney's point. First, you will draw an imaginary line extending from the umbilicus to the right anterior superior iliac spine. Then I will divide the imaginary line into thirds. McBurney's point can be found at the junction of the lateral and the middle third. Okay, I will push down slightly. If any pain was experienced when releasing my fingers, this will indicate acute appendicitis. During an appendectomy, the incision will be made at McBurney's point. Next, I will divide the abdomen into 9 abdominopelvic regions. This is formed by 4 lines, namely the right midclavicular line, the left midclavicular line, the transpyloric plane, and the transtubucular plane. The midclavicular line will be drawn. First, I'll have to locate the middle of the clavicle. Then I will extend the line inferiorly, and the same on the left side than the right. The transpyloric plane runs at the inferior margin of the rib cage, and the transtubucular plane extends from the left superior anterior iliac fossa to the right superior iliac fossa. This gives me 9 regions, namely the right hypochondrion containing the liver, the epigastric region containing the stomach, the left hypochondriac region containing the spleen, the left lumbar region containing the descending colon, the umbilical region containing some small intestine and the transverse colon, the right lumbar region containing the ascending colon, the right iliac region containing McBurney's point, the hypogastric region containing the uterus in a female, the bladder as well as small intestine, and the left iliac region containing the sigmoid colon. Thank you.
Thank you.
For the precession of the inspection, I'm first looking for any skin discoloration, any skin lesions, scars or striae, and all appears normal. The hair distribution is minimal, which is also normal, and there are no visible distended veins to suggest any liver cirrhosis or hypertension. Moving to the foot of the bed, the abdomen appears flat without any scaphoiding, and there's no distension due to factors such as fluid, fetus, flatus, phantom pregnancy, abnormal tumors, or any feces. I'm also examining the umbilicus, and the umbilicus appears normal without any inflammation. It is not pointing downwards, which eliminates the presence of ascites, and also the patient does not appear to be obese and therefore does not have an inverted umbilicus. I'm now going to ask the patient to cough. And in doing so, I am examining for any protrusions or hernias which may suggest any weak spots or tears in the patient, but all appears normal. I'm now looking at the symmetry of the abdomen.